I'll start with a little bit of our journey in a way, how we, from an idea to enterprise, we reached as a funded private limited company. And 3-4 innovation I selected. One of them was Mr. Muruganatham's innovation, which was the sanitary napkin production unit. So now I will take you through our journey very briefly. We run a social enterprise named Akar Innovation. Our for-profit arm works on the sanitary napkin machine sales and as well as the product sales, as well as the raw material sales. So how we work as a solution provider, where we supply the machine, we supply the raw material, we train the women to how to make, produce sanitary napkins, how to run their enterprise, as well as we do buyback of this product and sell it through the women-based distribution network. So our social arm works on the menstrual hygiene awareness part of it, whereas we reach out to the women for 6 months through a curriculum, and then try to help them on how, because the biggest challenge we see in this sector of sanitary napkins is like the awareness, as well as like the access to the products. So we address that through our not-for-profit arm. And we are the only company in India to make 100% compostable sanitary napkins, and globally we're the second company to do that. None of the MNCs have the technology right now. The impacts part, so we have set up about 15 odd units across the country, including Northeast, one in Manipur we are setting up next month. And we have been fortunate enough to got one MOU signed with Government of Gujarat to set up 600 production unit. We are also getting lots of queries from African countries. Hopefully very soon we'll be starting work there, where people are interested to buy more number of units, and in large scale in countries like Kenya, Uganda, Rwanda, and all. Thank you.
Brilliant.
I work for a school basically, and for a technical institute. We give training to the rural youth in various technologies. And so I started looking towards my work from this Sahyog point of view. And I found out like the community services, what we give to the community is a very important component of our program. And it helps us to generate the innovations and to take their contribution. We are doing this program and whatever this community service method in more than 100 schools in 4 states. I will just briefly tell you about the program, what we are doing in the school. The program we are implementing in the school is called as Introduction to Basic Technology. And this program is run from 8 to 10 standard. And 1 day per week, students work on various projects, various assignments, various productive tasks. So we are providing them a variety of services in all these 4 areas of nature: agriculture, engineering, energy environment, food processing. And the student, as a part of their learning, they are learning by doing the things. And while doing the things, they are working on these real life problems and providing the services. So these are some of the list of the services. So there are 85 kinds of different services, technology-based services, like right from the setting up the drip irrigation, to vermicomposting, to ferrocement construction, bamboo treatment. We provide various kind of services. Installing, making solar lamps, maintenance of the biogas plants, various kind of services. Last year we generated around 23 lakhs rupees by providing this kind of service. In 2013, we developed a business model with the help of SPGen Management Institute. So all these people help us basically. So this ecosystem I was talking about, so technology transfer, so it will happen in both ways, like from bottom to top and top to down, even the solutions and the problem. So these are some of the technologies which we developed in last few years. And everywhere, like on the second column, I mentioned about how the community contributor. So we developed some dryer like dehumidifier. It is made specifically for the Rahuri farmer. Rice making, handmade rice pounding machine. There is a demand for rice pounding machine in the city, in the big malls. And there is for the Chaitanya SHG in Rajguru Nagar, they got a demand for it. We do some kind of mechanization to reduce the efforts, make it a more kind of a, we use a simple machine principle actually. They gave us a 10,000 rupees to purchase as an advance to develop the machine, and then they will take it. So this way we got a community participation in terms of the raw material. They are not giving us a development charges as such, but I am developing with the help of students, so it helps me out. So these are some of the things. Yeah, thank you.
Recently, Telangana government, which has come from very exciting, and they are doing a lot of good bad things together. So recently they thought of calling farmers and giving them training so that they do better in their fields. So naturally, new university named Jaishankar University, professors called them, about 30 farmers from various villages, and asked them what should be the syllabus. Now, a lot of deliberation took place with the professors of the university, and finally, one youngster, young farmer, about 35 years, he got up and said, "Sir, tell us only one thing: how to reduce our input cost, and nothing else is required." Now, this is what university doesn't have. Now, that's what I'm the voice of people in the governance. The people have affordable, appropriate devices. They are creative, but it is not recognized by the government. Is the creativity of farmers and their devices are not useful to the public? That's a question. What I am saying is that there's a big gap between voice of people and the government. The one innovation there's a lady on the left top. She is moving her hand. It's a process of ASU process, we call it. It is a part of Pochampalli saris, traditional saris. She has to take 5 hours and 9,000 times for one sari, ASU process. If they do 2, she has to do 18,000, has to be done in the daytime. That kind of drudgery has not been addressed, but one boy, Mallesham, Lakshmi's son, he after 6th class dropout, he thought, let me reduce the pain of my mother, and he made a machine in 7 years' time. On the right side, you find the machine, the top and bottom. It works without any person, attendance. In 1.5 hours, he does the same job of 5 hours job of woman, and with just 2 rupees electricity. Now, this is a beautiful tractor, 4 horsepower tractor, my dear friends. It looks like a toy tractor. Yeah, click. This is a windmill, mastless windmill made by one TV repair mechanic. It draws water from 50 feet from the ground and 8 to 10,000 liters per day. Now, people speak about so many organizations, PRISM and Benabad and World Bank and whatnot, the private banks. No one follows this. No one. Without collateral, nobody gives. That urban collateral is required. Even for 1 lakh, when you go to a bank, urban collateral is required. It's a fact. So, still influence and corruption helps, and English language helps. If you don't know English language, it doesn't help again. Now, all these are barriers for our funding. Next. Last thing I have is some suggestions. Now, you can see on the slide, firstly, we have to have a bridge organization. It could be Fifth Estate, like Pallavi said, or Palestine, or Seva, any other organizations which are voluntary, understand both the worlds, the informal world and the formal world. And they will be able to bridge. Bridge organizations are very important to sustain, capture innovations, then also link them with the various knowledge things. And supporting completely, I spoke them. One last point I have is 2 points. Decentralized authorization of permission sanction is very important. Now, therefore, I thought a suggestion to consideration of all of you, can these social innovators or organizations can go directly to the foreign agencies, impress upon them, they approve, then government has to mandatorily accept and give the funds through government. But if you go to them and them, we can't go now. Government doesn't listen, so we are losing. So I think there should be a method where they listen to us, they accept it, and we move forward, and we also use the foreign funds. Thank you very much for the opportunity.
Good afternoon. I would like to just talk about some of the innovations we have done towards democratizing healthcare. One of the popular misconception is that poor people can't afford heart surgery. So around 12 years ago, we convinced the government of Karnataka state to come up with a health insurance called Yashaswini, in which we convinced 17 lakh farmers to pay 5 rupees per month. Today we have over 400 hospitals networked, and we have more than 40 lakh farmers paying 10 rupees per month. And in the last 12 years, 4,44,000 farmers had varieties of surgeries, and 66,000 farmers had heart operation. All this happened by sheer 5 rupees per month. The next misconception is that the tier 2 cities can't afford a heart hospital. People don't have the money to afford these hospitals. So we wanted to build a super specialty hospital with the 300 beds and medical equipments together for $6 million. Normally it costs about $25 to $30 million. It's very, very important for the Indian hospitals to educate the doctors about the cost implications of everything what we do in the hospital. Most expensive medical equipment is the doctor's pen. We have invested heavily on technology for us to give the data. We have an Oracle ERP on a cloud. This is the advantage of technology. We have 30 hospitals in different parts of the country. And every day we get the P&L account from every hospital. We always like to benchmark everything what we do with the best of the US hospitals and European hospitals. US hospitals are some of the safest hospitals on the planet. If 200 patients get admitted to American hospital, about 1 in 200 patient dies just by spending one night in the hospital due to medical error. It is not medical negligence, it is medical error. Because the hospitals do not follow the protocol. It is very, very important that hospitals follow the protocol in terms of treating the patient using the digital protocol. Now, this digital protocol can only come up in India. It cannot come up in US because of the privacy issues of patient data. I just want to share the last slide. This is about the hospital we have built in Cayman Island. This is because we believe Cayman Island is the best place for a hospital because of its proximity to the US. If world healthcare scenario has to change, America has to change. And America will not change unless they see what change is all about. So we are very close to US. Cayman Island is only 45 minutes away from Miami, and we built this hospital. And this is a classical example of the future of world healthcare. Entire world will depend on India, Indian doctors, Indian professionals, Indian nurses to manage their healthcare, because we are a country which can really service the medical needs of the whole world. For that to happen, we need to put our house in order first, think about the larger picture, and exploit the opportunity. I'm extremely grateful to you for giving me this opportunity. Thank you.
So my name is Swapnil Chaturvedi. People lovingly call me Poop Guy. And we provide awesome sanitation services to the urban poor. So this is how people are living in our urban slums. And these are the issues. Open defecation is prevalent all across India in urban slums. And the consequences are enormous. Our kids are dying, women are losing dignity, and we are losing 6% of our GDP because of these issues. And there are so many technical solutions we have, right? We have low-cost toilets, mobile toilets, self-cleaning toilets, EcoSan toilets, these toilets, that toilets. So 3 years ago, we also were doing toilets that used to convert waste into electricity, and nothing was happening. So we started realizing that technology is a means to an end, because people are not rational. So as far as sanitation is concerned, because this is what we do, we found that there are 3 critical factors, that there is lack of maintenance, lack of appropriate toilets, and lack of user engagement. And I have highlighted the middle because people focus mostly on providing appropriate toilets, which is actually an important piece of the puzzle. But what we believe is that user engagement and sustainable operations is what is going to take us to the next level. So this is what we do. We use technology, psychology, and sustainable business models in order to create awesome sanitation services for the poor. So what we are doing is we are making toilets accessible and affordable, but also aspirational. So this is the scenario now. We have 5 facilities, and we are scaling up to 50 in the next year. And this is the impact. Our customer satisfaction, a percentage increase in number of people paying for the toilets and number of people coming to the toilet for the first time is right here, and the goal is to reach 30,000 users. But there has been an additional impact in terms of local businesses, in terms of number of girls who use the pads for the first time, in terms of savings and all that. So what we are doing is we are creating a platform for social change because of behavior change strategies we have created. We want to work on financial inclusion. We want to work on waste management. So we are starting a rewards program in which people will be rewarded when they segregate their waste, and then nutrition and menstrual health. So this is what I wanted to end up with, that if we want to create any sustainable social change, we will have to work with technology, psychology, and sustainable models. Thank you.
Mr. Shikhandi?